Good morning, Vandana.
Morning.
I am delighted to be able to host you for Policy Talks. For those who are unaware of your contributions, I would just like to start with acknowledging your work on several aspects of community health and public health in India, building on your training and experience as a clinical practitioner in pediatrics. I would like to use this opportunity to talk to you about one specific aspect that is not going away. There is a lot of debate, there is a lot of uncertainty, and there is unfortunately a lot of misinformation. And that is about the role of fortification as a solution, almost a silver bullet, to the problem of malnutrition. I would like you to start with just introducing us to the idea, to the relationship between fortification and nutrition and the larger context within which you would like us to understand it.
Thanks, Ashwini, for having me in the first place. It's an interesting and important discussion, I feel. So we understand from our work and from a whole lot of research and practice that malnutrition is quite a complex phenomenon. It relates in our country, it's different in different contexts. And even in our country, we know that there's no one India, So the malnutrition or the anemia that you might see in an urban middle class family, especially amongst girl children and adolescents, would be very different from that we encounter in a tribal context, for example. It's driven by poverty and all the implications of poverty on education, on access to health, access to food. And when I say food, it's basically not the consumption of cereals to fill your stomach with, but the food with the diversity that would allow for good nutrition in all its forms. You know that we have these massive food supplementation programs. No? We have the PDS, we have food supplements through the ICDS system, through the midday meals. But they have contributed to staving off hunger, filling stomachs, but not at all to enriching our diets in the way that, everybody deserves. So, and that's one of the root causes of anemia. Now, fortification, unfortunately, that we're talking about now, is not fitting into the problem in the sense that what are we doing? We're fortifying rice with iron to combat anemia. The problem is that we are not eating enough of other things, protein-rich sources of food and so on. And yet the solution is basically saying, continue to eat the cereal, the rice, but I'll put in a chemical to make things better for you. So that's part of the problem. What it's also doing is it's diverting money away, possibly from the other solutions that would not only sort out anemia then, but would sort out the entire issues of malnutrition, many other micronutrient deficiencies and so on. The debate has unfortunately kind of swung a little bit to whether fortification works in a lab scenario, and it possibly would. But there's a peculiar problem that happens when you try to confuse medicines with food. And that problem really messes with the systems that we have for food, which should be very different from the systems that we have for drugs.
To what extent are these two, the first one being, while we are doing a lot to alleviate hunger and not paying enough attention to nutrition, and focusing on nutrition as a pathology, as a disease,
yes,
and a solution as a medicine, as a pill, to what extent are they related?
So the first thing to say is that these public programs of food supplementation, actually they're food security programs, and now they're housed in the National Food Security Act. They are extraordinarily important for this country at this point of time. But they are constantly under scrutiny, under threat. And it's important to understand where this threat actually comes from and who benefits from these systems and who actually loses out, or what are the opportunities that people are seeing if they were to disappear, these systems were to disappear. So we've been asking for a lot of reform in these, but essentially what the threat comes from a huge and burgeoning market that is being perceived in the country, because it's a huge country with a large population, and we're seeing a whole lot of processing leading to also ultra processing, overweight, obesity, the other spectrum, end of the spectrum of malnutrition. and associated non-communicable diseases, massive problem, looming large on the country. 1,000 different types of rice exist in this country, some of which are very rich in iron. And we should create systems that enable those to be consumed in their own areas and also to be spread out to other areas. Millets can be used rather than try to centralize and create a technological intervention that places all the power in the hands of basically essentially companies. But those are the threats. And I think that combining the food supplementation programs with all that emerges out of malnutrition would make the better sense than to use these vertical technical kind of intervention.
Given that nutrition is not the responsibility of any single department or ministry, right? There is women and child development, there is food processing industries, there is rural development, there is, it can go on, agriculture, of course, and so on. Do you feel that the technological solution, which of course centralizes power, is also a response to this helplessness, where a complex problem that requires a multi-dimensional, synergistic, coordinated, integrated effort is just not enabled by policy?
Yes, at best it is naive, and at worst there are vested interests at play. My own perception is that it is backed a lot by the corporate world in some sense, and they do influence policy. Conflict of interests are some, things that are visible to us in many ways. But what I want to say very specifically is that there are programs that tackle complex realities, and they have been effective. They exist in our own country. And it's only by that demonstration and making those programs more visible that we can convince people who are otherwise or doing it out of helplessness, ignorance, or naivety that it's possible.
No pun intended, but technology is a pill that many of us find very easy to swallow. But I also feel at the same time that civil society has risen to the task to show a mirror to policy. In conclusion, could you point us to, or correct me if I'm wrong, or if I'm right, point us to a few of these silver linings where we can derive our hope?
Typically, the middle class leads aspirations, as you know. The richest people who can afford 5, portions of fruits and vegetables in the day, and pulses and eggs and meat, are doing that. And hopefully that trickle down of information will come. There is always a civil society pushback that happens, and that's the hope and that's the conviction with which all of us work, because we see it every day. And I do think that the youth in our country are becoming much more aware of nutrition. There's a much more, awareness of diabetes and hypertension and the links to overweight and obesity. People are going to gyms, and I think there's a consciousness that's emerging on wellness and what it comprises in terms of diets and exercise and living conditions. But the issue is inequity. What the middle class can do is not something that is affordable by 70% of the population. So public policy needs to be very clear that it's focusing on the people who are getting left out, the people who can't afford things, and the people for whom it necessarily must exist primarily. And the focus has to be there, protecting their livelihoods, protecting, educational opportunities, protecting health services, and protecting decent food supplementation programs.
On that note of hope and silver linings, I would like to bring this opportunity to a close. Thank you very much for spending time with us and for your thoughts.
Thank you so much for having me.